The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we'll be talking about Medicare. It's the beginning of a new year, and we're talking about possible changes you might want to do to your Medicare Advantage plan. You have 90 days in the first part of this year, but we'll also be talking about other little changes that are happening to Medicare that will affect you and possibly your loved ones. A lot of great information, so stay tuned.
Respite care is amazing. If you are capable of doing it, the rewards are beyond measure.
Stephanie Young, respite care provider, on the unexpected benefits of helping people in need.
Being a respite care provider is an amazing experience. It's something that what you give, you get back 100-fold. You receive so much more than you could ever imagine.
To find out how to change lives, including your own, go to respite.mt.gov.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Hi folks, welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore. As I mentioned, we'll be talking about Medicare, some changes, some opportunities that are still happening this year to your Medicare plan if you can properly evaluate if it's meeting your needs. So we have a wonderful guest here. We have Janet Stellman, you're the State Health Insurance and Assistance Program Manager for the state of Montana.
Director, yep.
Welcome to the show.
Thank you for having me.
That's great. Now, in the opening, I mentioned that there can be some changes that a person can do to their Medicare plan. But, you know, as I understand, we had till December 7th to choose a plan, but now we have 90 days at the beginning of this year to reevaluate it. Tell us more about that.
Right. So what happened October 15th through December 7th was Medicare open enrollment period. So that was where you could evaluate your coverage for this year, 2023. You could change your prescription drug plans. You can go to a Medicare Advantage, or you can go out of Medicare Advantage. And so that took place until December 7th. Well, now, every year from January 1st through March 31st is Medicare Advantage open enrollment period. So maybe you didn't get switched in during the open enrollment last fall. You can, and maybe you don't like your Medicare Advantage plan, or you want to look for something new. This is your opportunity to switch to a different Medicare Advantage plan, or go back to original Medicare and pick up a prescription drug plan. So those are the only two things you can do during this open enrollment period, is go from one Medicare Advantage plan to another Medicare Advantage plan, or drop your Medicare Advantage plan and go back to a prescription drug plan. Okay.
Well, I know when I was signing up, I'm old enough, they had a plan evaluation things on the computer, I didn't really see a lot of good information there personally. So this is a time when you find out what your plan can actually fully do for you and if it's meeting your needs. How do you determine if it's meeting your needs?
Well, just is it covering, do you like the coverage you get when you go to the doctor or your other medical services? Does it cover your prescription drug plans or drugs that you take? You can go on to the Medicare.gov plan finder and evaluate those, and then if you have further questions, you can call the company directly and make a decision. You can also go to a SHIP counselor. We're located all over the state. Contact them and make an appointment with them, and they can help you with that process too.
Okay.
So.
And they're great. They're really they know everything. They can answer your questions. You have problems, they can help address those problems. But many times you don't really know until you've been in the plan a little bit, it's meeting your needs. But that March 31st deadline, that's still a little bit ahead.
Right.
So you can reevaluate. But what are some of the further points that we might want to evaluate as what's important in a plan that we know that it's meeting our needs?
Well, your doctor coverage, how's that? Do you pay? What's your cost every time you go to the doctor? What does it pay for other medical services? What are the maximum out of pockets? There's plans that have like around $5,000 maximum out of pocket per year, and there's some that have like $12,000. So maybe you want a lower out of pocket. Also, there are maybe you want some basic dental or vision or hearing. Some of the plans have some basic insurance, and some plans also have some extra supplementary insurance that you could buy and pay extra for those dental and vision and hearing. So those are just kind of things. Or maybe you're just not having fun in your Medicare Advantage plan and you want to just go back to original Medicare and pick up a prescription drug plan, then you can do that too. So.
And then I imagine too, we never know how our health is. Maybe by December 7th we're fine, and starting January 25th, pick a number, our health changes. So maybe we want a different plan that can better meet our needs. So contact the SHIP counselor if you would
SHIP
like
counselors are
the
best resource out there in your communities to help you. So,
well, now we've had some changes to Medicare over our prior insured year. What are some of the changes that we're looking at in 2023?
Well, one of the neat changes is that the premiums went down for Medicare. So last year you were paying $171.50 or something for your premium. And it went down to $164.90 or something like that. So that's kind of unheard of, that your premium goes down. It usually goes up so much.
Any insurance,
Right. So that went down to $164.90, and also the yearly deductible went down a few dollars too. So I think it's like $226 this year, where last year it was like $231 or something. So for Part B. So those are kind of some of the changes with premiums and deductibles. Same with Medicare Part A, the premium went down. I mean, most people have premium-free Part A because they have enough work quarters. But if you didn't have enough work quarters for Part A, the premium is $506 a month. If you didn't have enough work quarters, or if you had like 7.5 years to 10 years, then you could get it for $278 a month. But like I said, most people are get the premium-free Part A. So
that's great. And when you talk about that, I think, that sounds a little complex, and that's why you need someone that is an advocate for you, which is our SHIP directors. And they don't have anything to sell you, do they?
Right. Our SHIP counselors, and they're located all over the state. They may not live in your specific county, but they cover your county. They're trained in Medicare initially, and they're do training throughout the year to keep up to date on what the changes are with Medicare. So,
right. Well, we need them to be up to date because we can't really go over everything in a show here and keep you up to date and its complexities. But there are some other programs out there that possibly you could be eligible for. This is given to you through the area agencies on aging, which are throughout the state of Montana, and they provide a lot of services. Now, we'll talk more Medicare. Stay tuned. We'll be right back.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Medicare. Now, Janet, there's something that Congress and the President's side called the Inflation Reduction Act, and Medicare is an aspect of that. And how does that affect our Medicare recipients here in Montana?
Right, well, there's a couple things. Yeah. So the Inflation Reduction Act passed in August 2022. One of the big things it did for Medicare is it capped insulin products at $35 a month. Mm-hmm. So,
great.
These are insulin-covered products that are covered under your plan for each month. So, per prescription. So, if you have 2 different insulin products, you're going to get 35 and 35. So, it doesn't cover like the new kind of specialty drugs that are used for diabetes, like Ozempic, or those kind of things don't fall under the 35 cap. It's just the actual insulin products, and your plan has to cover it. So one of the things, so January 1st, you should be paying no more than $35 for each insulin product that you use. However, the companies haven't had a lot of time to get this straightened out, so you may actually end up at the pharmacy counter and they're wanting to charge you more. So that's okay that they're going to charge you more, but you're going to get reimbursed to that $35 cap. And they have until March 31st, the drug companies, to get that straightened out and make sure that that when you go to the pharmacy counter, your insulin product is $35. So
right, and you'll be reimbursed. Now, Janet, you mentioned that if your plan covers it, is that alluding to if you have a Part D plan or if your Advantage plan covers it? I mean, is there a chance
your prescription drug plan, whether it be through a Medicare Advantage or a standalone prescription drug plan?
Okay.
So hopefully that when you met with the SHIP counselor, hopefully last year, and they were able to help you find a plan that covers your insulin. So,
and if not, you have till March 31st.
Well, for Medicare Advantage, to switch Medicare Advantage plans or go back to original Medicare and pick up a prescription drug plan. So yes.
Good.
So, and then the companies need to have it worked out before March 31st, and going forward, when you go to the pharmacy, you should pay $35. So, another biggie through the Inflation Reduction Act was anytime you go to get a vaccine that's covered under Part D, you should pay zero copayment and zero deductible. So these are vaccines that are covered by your prescription drug plan. So that means shingles, flu, all that kind of stuff. So
COVID, yeah.
Yeah. So another thing that happened through the Inflation Reduction Act, or about that time, I'm not sure if it's really part of the Inflation Reduction Act, but another couple changes that happened to Medicare are initial enrollment periods. So the initial enrollment period when you become eligible for Medicare, it's the month of your birthday, 3 months before or 3 months after is your time frame to sign up for Medicare. And it used to be that whenever you, depending on when you signed up, is when your Medicare would start. So if you signed up the month after you turned 65, your Medicare wouldn't start for 2 or 3 months after that. But now with simplified enrollment, your Medicare is going to start the month after you sign up or you enroll.
Good.
So that's good news. You don't have to wait for that. Another change is a general enrollment period, and that is, again, January 1st through March 31st, and it's for people that didn't sign up for Medicare when they should have or could have. And it used to be you sign up January through March, and it would start July 1st. Well, with this new simplified enrollment, it is going to start the month after you enroll. So you don't have to wait till July. You don't have to incur further penalty waiting till July. And so that's going to be helpful to a lot of people.
Yeah.
Another change is the special enrollment periods for Part A and B. So if, let's say that during the public health emergency, so this COVID stuff that's been going on, and you've been on Medicaid, and when the public health emergency ends, which we're not sure of when it's going to end yet, but it's going to end probably this year sometime, those people that were on Medicaid during the public health emergency are probably going to lose it. And so maybe they aged into Medicare during this public health emergency, and they didn't enroll in Medicare because they had Medicaid and all that stuff. Well, they're going to get a special enrollment period to enroll in Medicare once they lose Medicaid. That's going to be through the Social Security office. They'll need to contact the Social Security office to talk to them about how to get that special enrollment period once the public health emergency ends.
Right.
So,
yeah. Well, you got a lot of great detail there, and again, when you talk about it, it's like there's a lot of fine detail here that an individual needs to know about. But we have a resource, the SHIP counselor.
Right.
And what's important is they don't have anything on the shelf to sell you. They don't benefit what your choice is, but they'll help you choose an appropriate plan. They don't decide for you. So call the number, right?
Yep, and they're free, confidential, unbiased. They don't work for insurance companies. And they're up to date on their knowledge of Medicare, so they can help you work through that.
And you get these explanation of benefits, and you have questions, they can help you with that.
Right, yep.
If you have problems.
They can help. They can do so much more than helping you enroll during open enrollment or whatever. They can talk to you about, explain your bill, your bills to you. They can help you with appeals. They can, if you call and want to know what if a service might be covered, they can walk you through that. There's so much more that they do and are available for. So
that's great. And they're part of the area agencies on aging, and there are other benefits out there for seniors beyond Medicare, Medicaid, and Social Security, and they'll let you know about that. Stay tuned. We'll talk more.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
A decade of Montana fourth graders on Energy Share. When winter gets tough here in Montana, Lily Wallace knows who can help keep your home warm. Energy Share. That's right, says Livia Little. Energy Share wants to make sure that every Montanan stays warm, no matter how cold it gets outside. Thanks to Energy Share, we'll be cozy tonight. Energy Share is not a government program. It's neighbors helping neighbors who face energy emergencies the Montana way. Call or visit our website today. Energy Share is a good way to care.
Did
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Medicare. An interesting aspect about Medicare is what about the people who are incarcerated? They go into prison, maybe they're under 65, maybe they go in there 65 and older. Maybe they can pay their premiums while they're in there, maybe they cannot. Janet, what about the people who are incarcerated? How does Medicare work for them?
Right, so Medicare does not pay anything while somebody's incarcerated or under the supervision of the Department of Corrections. Or so what happens is a lot of people get, when they go to, if they're in prison or incarcerated, maybe they age into Medicare, or maybe they had Medicare when they went in. They can continue to still pay their premium every month while they're in prison, but that might be hard to do. So a lot of people lose their Medicare when they are incarcerated. So when they come out and they're done being, they're not incarcerated anymore, or they're not, there's different aspects, whether you're in a halfway house or a pre-release center. It just depends. But it used to be that they'd come out and they'd have to sign up again during general enrollment, which was January 1st through March 31st. And then they'd have to wait till July 1st for it to start. So if they're coming out of prison in April, they're going to have to wait almost 10 months before they can sign up for Medicare again. And it's not going to start for another, till July 1st. So that's over a year they're waiting to get Medicare coverage. So special enrollment period is for those people, it begins the day they're released, and it ends the day of the 12th month after they're released, that they can sign up for Medicare. That is done through contacting Social Security Administration. So, before it was kind of almost setting them up to fail as far as their health care was concerned, and getting that kind of stuff their health needs taken care of. So that's a good opportunity for them to get back into Medicare and not have to wait.
Not incur huge financial debt on top of their sentence. It's amazing.
Yep.
But now, Janet, I know there are what we call helping programs that are available out there, and I imagine they could be available to those that are incarcerated to help pay their premiums. Let's get them on Medicare versus Medicaid. What are some of the helping programs that are available to Montanans?
So my favorite topic is Medicare helping programs. These are for people that have lower incomes and resources. You had alluded to that with the last topic we talked about. If they're incarcerated, they can't get the helping programs to pay their Medicare. But anyways, once they're out, or anybody else who has lower income and resources and qualifies, there is the low income subsidy program, or extra help it's called. It is through the Social Security Administration, and it helps lower their premiums, their co-payments, and their deductibles and stuff through Part D, so the prescription drug coverage. So maybe before they were paying a premium every month for their Medicare or their Medicare prescription drug plan. Maybe they were paying, a percentage of each drug that they got, whereas with low income subsidy, you're paying like $1 to $10 per prescription as long as it's covered under your plan. So that's a big help. The other program is the Medicare Savings Program, and you might have heard of those as QIMBY, SLIMBY, and QI. Those are administered through the Medicaid office. They pay your QIMBY, being the Cadillac model, I call it. It'll pay your Part A premium if you have a Part A, have to pay a premium for Part A. It'll pay your Part B and premium of $164, and it will pay help pay those co-payments, because traditional Medicare is 80-20 split, so the recipient, the beneficiary, is responsible for that 20%. Right. But when you're on Quimby, it picks it up, that 20%, so that's nice. But that's for the lowest income folks, okay? Yeah. So then there's two other programs. There's SLIMB, or Special Low Income Medicare Beneficiary, and Qualifying Individual, and those just pay the Medicare B premium, so that $164.90. But still a great big help to those, because that's a big amount. The other program I want to talk about real quick is the Big Sky RX program. It is a state ran program, and it was started through the Schweitzer administration. It pays up to like $38 per month for their Medicare prescription drug premium. And it's for people with a little bit higher incomes that don't qualify for things, and they don't look at resources or the things you own. So they just look at your income, and it'll pay up to $38. It's not much, but it's a little bit, and it's a homegrown program funded by tobacco tax. So great programs, and I just did a survey of my counselors this week about what their favorite thing was during open enrollment that we just went through, and their number one thing was helping people save money. And getting these big help from these helping programs. One more thing I want to mention, there's a scam going around right now, and it's about Medicare is going to issue these new plastic Medicare cards. And so you might be getting calls, and they're poking around for information. That is not true. Medicare is not issuing new Medicare cards, and they won't be calling you. They'll never call and ask you for your Medicare number, because they already know it. So just really be careful with those calls. Just hang up if you get those. So Medicare will never contact you and ask you your personal information. Either will Social Security. So
that's right.
Yep.
Well, I know that you can go into your Medicare site, go to My Medicare, and you can print out your own Medicare cards on your printer.
Right.
And then I clip them up. I got one on my wallet. I got one on my cell phone.
Yep.
So they're available to you. You don't have to go through another party to get them.
Right.
But keep that number confidential, right?
Yes. And don't, if you get a call and it sounds too good to be true, hang up,
Or call your ship director.
Right, your ship counselor.
You're the director.
They can, they're usually up on what's going on with Medicare and any scams, especially the SMP program, the Senior Medicare Patrol. That's what they specialize in, is Medicare fraud, waste, and abuse. So,
so let them know. And they can chase it down, and they can let other people know.
Right.
Much like you're letting people know about Medicare. And Janet, thank you for coming on the show today.
Thanks for having me.
We really appreciate it. And for our viewers, stay tuned every Sunday, same channel, same place. See you there.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.